Welcome back. Now, as a nation, we use more toothpaste than any other. Did you know that? We're continually bombarded with ads for toothpaste, but you never hear much about the natural ingredients paste. Well, on Espresso, we're going to remedy that with the help of dentist Marc Mortiboys and also our guinea pigs, Mandy Holmes and her daughter Michelle, who tried out a host of natural ingredient toothpaste for us. Michelle not looking very happy about that. Did you not like them? No. Oh, right. Well, there we go. Stop first of all, Mark. What are they? Why are we getting more into these natural ingredients?
Well, Tony, wouldn't you agree there's a general trend up to a point by families to go more natural? There's more and more talk about going more organic and more natural.
I suppose so, yeah, in
whatever
everything.
we eat or what we drink, and the toothpaste movement is going into that as well. But it started a number of years ago, good 10, 20 years ago, by a few companies that are just very into totally plant-based products. They may be more vegan-minded companies or homeopathic companies, because the flavouring, the main flavouring is mint, isn't it?
Yeah.
And
I was asking that before.
yeah.
Why are all toothpaste mint?
Well,
My daughter hates the taste of mint, and it's really affected her use of toothpaste.
I'd say that's another reason why there's a variety of new flavours coming in, and natural flavourings as well as artificial ones. But mint also stops and blocks homeopathic remedies, so people who are into natural medicine and homeopathy will actually go for a mint-free toothpaste. But mint does actually seem to stimulate the taste buds and make our mouths actually feel fresh. Whether they're actually fresh or not is just maybe an illusion, but it definitely stimulates the blood flow into our mouth and makes our lips all pucker afterwards, doesn't it?
So there is a reason for it.
Yes.
Okay, well Mandy and Michelle have been testing 4 of these we've got here. Am I counting properly? 4, yeah, so we'll have a look at them one by one. First of all, we'll come to... I'm not counting at all, probably. How many have we got there? We'll come to that in a minute. It's 5. Oh, dear, it's so difficult on this show. I'm going to start with this one, moving on from my terrible maths. This one, Kingfisher, which is actually strawberry flavoured, isn't it?
Yes.
First of all, I'm going to ask you, Mandy.
I couldn't use it. I'm allergic to bananas.
Bananas?
And believe it or not, it's got bananas in it.
Oh, right. Well, that's presumably... Oh, yeah, apple extract, banana extract,
What
mandarin
find
extract.
with the natural ones is you get a list of every single ingredient, and they're all plant-based, usually.
So there's not much point going further. Did you expect a toothpaste to have banana in it?
No, I didn't. No.
So that's all a flavour thing. Okay, Michelle, did you like that?
No, I didn't like that one.
Well, no, was it the taste you didn't like?
It's the taste after I used it that it left me in my mouth.
Oh dear, that's not very good. Do you like strawberries normally?
Yes.
Oh, you would have thought that would be good. Actually, that one's for children, it says there. But that's interesting. Well, apple, banana, mandarin, all those kind of things. Do they work any better than an ordinary toothpaste, if you see what I mean?
That's really debatable. I think it's personal preference. I think also with the taste, it's personal preference. And it's interesting, we have a natural toothpaste with a natural ingredient, which actually causes a potential problem with somebody who has a banana allergy. But there's also, I get a growing list of complaints of people who end up having allergies or burning sensations to their mouth from mint, and sometimes even sloughing off of the inside skin.
There's what? Sloughing off?
Sloughing off, a kind of a burn, and then it sort of
Oh, right.
sloughs off. So that's quite common.
That's a dentistry term, isn't
Yeah.
Let's move on, because we'll talk more generally as we go along. We're going to look at the next one, which is, I'm going to get this right, it's Desert Essence. Now, this is tea tree oil, which seems to be the trendy thing these days, tea tree oil.
It's a natural antiseptic. It's a very powerful antiseptic, mainly coming from Australia, from the eucalyptus trees.
Right, well, let's get to Mandy on this one.
No, didn't like it.
Very much an acquired taste, isn't it?
It was the texture. It was so oily.
This is with, not only is it tea tree oil, but it's baking soda and essential oil of ginger. Can I have a taste of this one? Does it taste of ginger?
To be honest, I don't think I left it in my mouth long enough to find out.
Yeah, it does.
An acquired taste, wouldn't you?
Well, no, I actually like ginger, but it was the texture and everything.
It's an odd taste. Did you like that one, Michelle?
No.
Oh, no.
I think you only tried them the once, didn't you?
We did, yes.
And something I get this kind of a complaint quite often, if I suggest a natural toothpaste to some patients, is that initially it takes a little bit of time getting used to a slightly more bitter flavour or less sweet flavour, because a lot of the general toothpaste do have artificial sweeteners in them. We wouldn't have sugar in them usually, but they do have artificial. So I think we're getting accustomed to sweeter toothpaste as well as sweeter foods these days.
Mm.
So natural does tend to be a little bit more bitter or less sweet sometimes.
Okay, let's move it on. You're going to say the name of this one.
Echinacea.
Echinacea. So it's A. Vogel is the company.
It's a Native American herb that boosts the immune system. That's been shown to anyway.
So I mean, these are like health foods. These.
Yeah, that's it. That's the reason why they're getting quite trendy. Is more of a plant approach, a herb approach to fighting gum disease and tooth decay.
Mandy, you must have liked this one.
Nope.
Come all the way from South America or whatever it was for you, and you don't like it?
No.
No.
No. Couldn't stand it.
Again, the taste. Did they feel any different? I mean, the texture.
Yes, the texture's different. They leave a real sort of chalky taste in your teeth and in your
Michelle.
tongue.
Did you like this one?
No.
Do they feel different in your mouth? Do you know, apart from the taste, do they feel different to your ordinary toothpaste? Didn't leave it in long enough.
No, I didn't leave it in long enough.
And I'm going to ask a terrible question. How often do you brush your teeth a day?
Twice a day.
You do it twice a
Excellent.
day.
Good stuff.
So that's very good anyway. Now let's move on to the next one, because I think we might get a result from Mandy on this one. You never know. No pressure. This is Planta Pura, and this is interesting. Long-lasting breath-purifying toothpaste with natural sage leaf. Mandy, you liked that one, didn't you?
I would use it.
Yay, there we go.
Yeah. And sage actually freshens the breath and takes odours away.
Ah,
Natural sage.
you still didn't sound too keen. You would use it.
I would use it. I wouldn't buy it.
Why not?
I just prefer minty taste.
Ah,
I've used
you
minty
see.
for years.
Got a condition, but you got used to it, haven't you?
Exactly.
I suppose that's part of it, isn't it? That you sort of get used to that fact that they should taste minty to be fresh. And these have still got fluoride, some of these. And
Some, all the natural ones will actually say whether they're with or without. Usually they're both. You have a choice.
Michelle, did you like this one?
No.
They're not doing very well on this. Get to the last one. Now this is from Boots. It's Botanics toothpaste, and we were all saying earlier that the tube for this looks like quite a posh conditioner or something like that. doesn't it?
Foundation cream or something. That silver cap.
Again, Botanics. I mean, it's interesting that Boots, a bigger company now, getting into these, and they
Yes.
say all active, natural ingredients, antibacterial again, all those kind of things. Green tea, natural lemon oil.
Yeah, it's natural herbs yet again for antibacterial. But what we must realise is that we have an epidemic still of gum disease. It's really the most common disease known to man, gum disease.
Is
And
that
tooth
right?
decay is still pretty high, especially in inner cities.
So anything we can do to stop it.
Absolutely.
Mandy, lemon flavoured.
Didn't think it tasted lemon to me.
Oh,
Still the
didn't
real chalky taste after you've finished using it.
Right.
Yeah.
Just to finish on this, Michelle, did you like this?
Yes.
Yes! Did you taste it? Because it's like, I'm going to see if it is lemony to me. It is lemony. Did you like that one then?
Yes.
So that's one that you would use,
Yes.
but do you still prefer your minty one?
Yeah.
Oh well, and they're much more expensive as well, of course, aren't they?
Well, I think with manufacturing, as they're all small companies, most of them, apart from Boots maybe, they obviously at the moment have to have an increase in price. But they are about £1, don't they? Seem to be about £1 more expensive. So.
And you're bringing plants all the way from South America,
Yes,
as well.
exactly.
Okay. Well, Michelle and Mandy, thank you very much for that.
Thank you.
At least we found one that both of you
We
would
did.
use.
Yeah,
That
well
wasn't too bad. Now, Mark, you come with me.
Okie dokie.
Because you'd expect that dentists with all those drills would be enough to give you a headache. Sorry about that, Mark. But not so. Mark will tell us in a moment about the relief they can offer as well, especially for migraines, because an astonishing 6 million of us suffer from these often blinding attacks. But these days, there are a host of ways of managing the pain. Well, Rebecca Porter is from the Migraine Trust, and Mark, our dentist, of course, has some good advice. But first, someone who suffers with migraines, Michelle Cogswell-McGrath. Now, Michelle, first of all, do you get them very often?
I used to get them a lot, but now I have them under control, so I know what sets them off, and I can usually stop the attacks before they actually get really bad now.
But if you don't get there, for those who don't really appreciate what a migraine's like, who think it's just a bad headache, what actually happens to you?
Well, it's not a bad headache, it's such a debilitating
Isn't that the
thing.
most annoying thing in the world?
Yeah, no, it's much more than a headache. What happens with me, everybody's sort of different, but I usually get a stinging sensation in my head first, and I get very, very sick. And it gets so bad sometimes, you know, I can't walk across the floor without vomiting as well, and the pain is just incredible. You just want to die, curl up and die.
So to stop those, you say you know when to stop it.
I
That's
usually-
drugs, presumably, is it? You take
Yes. I usually know when an attack is going to happen. Sort of stressful situations and certain foods, but I have a very good doctor who's given me a product called Imigran, which I believe is a very expensive drug. And if I take...
I think that's just a prescription one, isn't it?
Yes.
There's
yes,
quite a
it
few
is.
of these different brands around, aren't there? That
Yeah, migraine relief and various things, they don't seem to do anything. They don't touch it,
I think
really.
they work for different people. 'Cause
Yeah, exactly.
That's the thing.
I want to ask Rebecca about this, because they're all, there's not such a thing as just one form of migraine even, is there? There's all different
There's different
ways.
types, that's right, there's different types of migraine. Some people have migraine with aura, where you get a warning sign, which can be
an
visual
aura, you mean? So you start
disturbances.
feeling different.
You can do, that's a very early stage of an attack, but normally the aura can be a visual disturbance, or your hearing can be affected, and that really is a warning, normally about half an hour beforehand, that you're actually going to come down with severe head pains, very often nausea, vomiting. There are other types of migraine where some people don't actually have the head pains, where they have the visual disturbances, and there's one very frightening form of migraine where there is temporary paralysis. So that particularly is frightening, especially if you're having your first one and you suddenly find you can't move, or you mentioned about not being able to walk, or your movement being affected. That's pretty scary.
And the weird thing, the question, do we know why migraines happen yet?
We don't.
What
I
is
mean,
actually happening? Not what causes them, but what is actually happening?
Well, in a sense, there's a combination of different factors that are involved. You've got the sort of intestine, you know, the nausea, sickness, etc., the stomach being involved, the head pains, blood vessels, etc. involved. I mean, it's a whole range of different symptoms that actually come together to make a complete migraine.
And an awful lot of people really don't realise just how bad it can be.
They don't.
I should say,
They
I'm being
don't.
so sympathetic, because I've... Is this wood? For about maybe 2 or 3 years, I haven't had one. But when it really kicks in, it is horrible, isn't it?
I think that's a very hard thing to cope with, is not always getting the support, either in maybe the workplace or at home from people. You know, people so often think it's just a headache, and there are so many, you know, other factors involved. You know, you literally just have to maybe lie down, or you can't carry on. And I think it's a lack of sympathy that so many people get angry and frustrated with.
Well, I once had a migraine for 3 days when I was on holiday in North Wales, and was with a friend who was driving me mad because he kept trying to help me, though, you say, simply. It's the only time I've ever threatened to kill someone and meant it. But we've got a whole bunch of things on the table here, because you often hear about what causes migraine. What are the most common things that...
They're not so much causes, they're actually more triggers in
yes.
fact. And there's a whole range of things here. It varies so much from person to person. And very often it can be a combination of things that will actually trigger it off. So it may be, for example, I mean, we've got chocolate here. Chocolate is a very common one. It could be that particular milk chocolate does it, but maybe white chocolate doesn't do it. Fruit, I mean, fruit is very good for us. Citrus fruit is very good for us, but it could be a migraine sufferer couldn't take
But that
citrus
kicks it
fruit.
off in some people, does it?
Yeah,
Fruit
it can. It can
surprises me.
actually trigger it off. It can actually be a combination of things. For example, if you're very stressed, or particularly with women, if it's their period and it's a combination of stress and your period and maybe a food product as well, that can actually, the combination of things can actually trigger it off.
And
as
alcohol there as well. That's
And alcohol. More often than not, though, people will say it's red wine that actually can be a trigger factor, or port, something that's stronger. Obviously, I think if you're going to drink too many of those, then you are going to suffer anyway.
It may not be a migraine anyway.
Yeah,
yeah.
exactly.
Well, I'm going to ask Mark here, because it seems odd to some people. We're asking a dentist about migraines.
Right.
But you can help here.
Absolutely,
With
yeah.
some people.
Yeah. I mean, going back to what's just been discussed, is that migraines are so multifactorial. Like a lot of diseases, there's so many different factors. But as we are looking deeper and deeper into different causes, we certainly are seeing for some people that there's a muscular reason, or musculoskeletal reason around our jaw joints, because the muscles all around here where some people get the migraines are linked to the jaw joint, and this is obviously linked to the upper and lower jaws. And if those two jaws are out of balance, or the joint is out of balance, then potentially some people, if they're very sensitive, can get these spasms, quite often linked with lack of oxygen or a cramping.
So they might need to
It's like a
have it
cramping in the muscle.
straightened or something?
Well, first of all, they'd have to just have the muscles relaxed and released by wearing a piece of plastic between their teeth.
Go on, show us it.
Oh, well, believe it or not, I'll make a confession here. I'm a migraine sufferer,
Okay.
and I've been questing for many areas, in many directions, but I used to get only about 4 a year. so it was tolerable. And the only way I could cope would be just to walk all night. I just go outside and I walk. Rain, snow, sleet, whatever, I'll just walk. And that's changing my focus. That's the only way I could change it because it was just such a throbbing pain. I've been wearing my own splint, which is a piece of plastic.
Yeah, we're going to see this.
This
This
up.
is a well-worn.
A well-worn one, as you can tell. Been wearing it for 1.5 years, and in fact made it myself.
Right.
And since been wearing it, I've only had one migraine. So whether this is
So when do you wear this at night?
I wear it at night and as much as I can in the daytime as well. So even while I'm treating patients, I'm often wearing it. The reason why I've been wearing it for a year and a half.
They've noticed, because put it in while you carry
Oh
on
yes,
talking.
you'll hear me.
You
Very
would notice.
sexy voice here. Hello, Tony.
Because people probably notice when you've got that in, don't they?
Absolutely, yes. As all the viewers are now noticing. It's a bit lispy. However, it was a lot worse when I first put it in. And some people will not wear it that often during the day, but as long as they wear it at night time, that will be very helpful for a lot of people. In fact, let me just take this out a second.
Yeah.
In fact, there was a recent research program where in Ireland, wasn't there? The Professor Lamy
That's right.
actually created, I think there's something like 70% of migraine sufferers had relief during the 1 year of wearing their splint.
So that's one possible way. Cause
Exactly,
we're running out of time. Rebecca, what should someone do if you get serious migraines? A lot of us sort of just end up using more and more of these various patented painkillers. Should you go to a doctor? Because a lot of people think, well, it's a migraine, there's nothing they can do about it.
I think it's so important to go and get it checked out. You need to make sure it is actually migraine you're suffering with, and also that there are not other factors actually involved. So go and see your GP. Then what they may recommend is they may recommend over-the-counter products. So, I mean, there's a range here on the table. Or if it's very severe, as Michelle has mentioned, it could be that they'll prescribe something for you. If people are suffering very badly, I mean, there's a whole sort of number of people